Hello, I am here with a very important topic on the occasion of Mental Health Week, and that is mental health. Mental health, as we know, is as important as physical health, or maybe even more important. And but still, to have a mental illness, to be mentally unhealthy, is still considered a stigma, a bad thing, a problem beyond recovery. So is it so? So I would just try to unravel a few scientific facts on mental illnesses. This year's Mental Health Week or Mental Health Day gives a slogan of mental health is everyone's right. We know that physical health is everyone's right. Similarly, mental health is also everyone's right. So one should be aware of the reasons for mental health. We know that mental illnesses are divided into so many headings medically. There is schizophrenia, where you are controlled, your thoughts are you feel that your thoughts are being controlled by someone else or something else. There are mood disorders, where the persons may range between mania and depression. There can be severe depressive disorders, there can be anxiety disorders, there can be eating disorders, etc. So whatever be the disorder, it is the disorder of brain. Just like a physical illness, it has a scientific basis, it has a chemical basis, it has a molecular basis in the brain. So one has to look at it objectively, just like one looks at a physical illness and treats the physical illness. So mental illness is not due to as a result of poor upbringing, poor parenting. It's not due to weak personality, or it is not a nutritional deficiency, or it is not just caused by stress. It has very definite physical reasons. Not physical, but there are very specific reasons which need to be looked into. Very few physical reasons like thyroid disorders or vitamin B12 deficiency can result in a mental illness, certain drugs as well. But we need to have an expert advice whenever there is a suspicion of a mental ill health. Just being a little anxious, just being a little depressed, just bereaving on the loss of a close family member, this is not mental illness. But if this grief goes on for months and years, you feel that you are being controlled by something else, some external power. If you feel that your mind is out of your control, you feel like doing things which may be harmful to others or harmful to others, we have to think of serious mental illness. And if this goes on for more than 3 months, definitely you must seek medical help. Let us not ostracize the patients who require help, and counseling is not the only help that they require. Counseling has to be done very systematically along with drugs. There are certain areas where you need to give drugs in order to combat or in order to set right the chemical imbalance that has happened in the brain. We know that nearly 35,000 to 65,000 thoughts crosses one's brain in 24 hours. Many of these are negative. So if but to create positivity, one can be mindful, and one can be mindful of the thoughts that passes across one's brain. This is about a person of a normal mental health. But sometimes when the mental health gets deranged, it should be looked at like a neurological disease, illness of the brain, a chemical imbalance of the brain. And many times you have to have the help of a medical personnel in terms of drugs. All the psychiatric drugs are not sedating. They wouldn't just put you to sleep and make you a vegetable. It's not true. Many of the drugs are important in order to restore your normal functioning. So they are not to make you a vegetable, but to restore the normal functioning in the society. So let us take a vow to do away with the stigma of that is attached with mental illness, and look at it more objectively, look at it more scientifically, and handle it just like a physical illness. So wishing you all a very mentally healthy days. Thank you.